Healthier Together, sponsored by Regents Blue Cross Blue Shield of Oregon.
I'm all about advocacy. I'm all about talking about it. But the powers to be, man, let's move past the talk and support the talk.
And this week's Healthier Together, we're continuing our conversation with Dr. Keith Dempsey about mental health, how to talk about it.
And today, the challenge is unique to the Black community. Brittany Falkers has the story.
I am a clinician, I am a speaker, I am a community advocate, I am whatever my people need.
Do you see that? There's those nuances there.
Dr. Keith Dempsey is on a mission to empower people to talk about mental health and in turn have better health overall.
I love helping people. I love giving them an opportunity to find that special thing within themselves to make themselves better.
He works in Portland and has taken his message on the road to break stigmas and get people talking.
It's not just the talking about it. It's creating the space for listening. The reason we don't talk about it because we can't trust people with our vulnerabilities.
But creating trust and breaking down stigmas around mental health comes with historical and systemic scars within the Black community.
There's a history in the medical systems, there's a history in the mental health systems that African American folks have not been treated well. So when you haven't been treated well and you haven't gotten good outcomes, you are in a place that's not safe, you stay away from those places. Sometimes in the African American communities, we say we're just going to keep on keeping on.
Research shows that this can cause generations of families to ignore mental illness, which is then compounded by the stress of systemic racism. It's estimated that African American adults are 20% more likely to report serious psychological distress than white adults, but far less are likely to seek treatment. Statistics show that about 25% of African Americans seek mental health treatment compared to 40% of white Americans.
It's time to be able to listen and take care of folks in their vulnerable space, in their vulnerable spaces. Because when we can do that, then folks will know it's okay not to be okay. And I have safety in the room.
And maybe that's in a church, a community center, or in your own family or friendships. Dr. Dempsey says it's essential to create safe spaces for people to talk.
And for those of us who are not mental health counselors, guess what? You all don't have to do anything but listen. It's so easy to say, if I were you, but guess what? You're not. It's so easy to say, you know what, my grandmother died, I felt that way. No, you didn't. That's my grandmother. You can probably relate. I just need for you to listen and create some safe space.
And when it comes to getting mental health care, it can be hard for people of color to find therapists and counselors who look like them. So when finding professional help, Dr. Dempsey suggests asking that potential counselor, therapist, or doctor if they've ever counseled a person of color, and ask them about their approach.
If this person says, great question, I'm glad you put that forth, and opens it up and starts talking about anti-racist systems and starts talking about the racism that has been in the system, and is okay talking about how hurtful and harmful it has been, boy, that's a place you can think about being.
And Dr. Dempsey is putting the onus on people in power to make real changes, to create more safe and culturally diverse places for people to talk about mental health, create community, and find help. Brittany Falkers, KGW News.
For more resources and more stories to help start the conversation on mental health, you can visit kgw.com/healthiertogether.